So my presentation is about doing most of our ROP screening work on mobile. So it's basically an app which we have designed. We all know that, yeah. So when we do ROP screening, we know that there are two major important points. One is to predict whether there is a disease and whether we can prevent and whether it needs a treatment or not. And the second part is the medical legal aspect of it. We all know that most of the cases nowadays in Western countries are for ROP not detected properly. So I think record keeping is one of the most important parts of the entire process. When was baby referred, whether baby was seen by the ophthalmologist or not, what was he advised, was he diagnosed correctly, what was the treatment part, what were the complications of the treatment. So basically the stakeholders in ROP screening are ROP specialists, that is us, ophthalmologists, neonatologists, and of course the parents, because it is their kids, so they also are interested into what is going on in these kids. So this is a simple solution where once you get started, there are three things on the front screen. We click the ROP specialist, put our mobile number or login password, and we get entry into it. Now this is where it gets interesting. You have a screen where you have seen patients, unseen patients, and new patients. New patients are patients which are loaded by neonatologists on your screen. So they will put up all the details about the patient, what was the date of birth, expected date of delivery. So before you go to screen in the NICUs, you already know what is going on there. And once you screen them, there will be a screen where you can upload the picture, if it is a picture-based or a fundus camera-based screening, or if it is a manual screening, you can put up your own whatever is your diagnosis. So this is the patient, this is who has referred, this is the consultation part. You can change zones, you can change the picture, you can change what is the treatment. So essentially, it is bringing everything on the mobile for the ROP specialist because it becomes easy for him. And the next part is, next stakeholder is neonatologist. Now often what happens is whatever we are doing, they are not aware of that. So all, like I am going to 5 NICUs and I have 5 neonatologists which are with me. Now all these neonatologists are at a different point, and sometimes I also don't remember what happened with baby of Rupa or baby of Kamini. So they can themselves see on their screen what are their patients which they have they have put the data inside. They can get the reports, they can see whether the patient has already been seen or it has been missed by the staff, patient was not dilated. And then finally the last stakeholder is parents. Of course, parents are the most important stakeholders because they are the ones who want to know what has happened to the kid. So they don't have a login. They only have a login with their mobile number, and they will get an OTP and they will log into it. So there is no mismanagement between which patient was seen and they can get a report of another patient because it is purely based on their mobile number. So they they cannot change anything. They just can download the report. They can talk about it, what has happened, and they have different screens where you can counsel them. There are videos in this. You can put up your own ROP video, what you are talking about, and you can give more information in local language also. You can talk about it. And finally, what is new in this? So when I started looking at my ROP practice, I could not get a single EMR or a single solution where I can easily do my ROP practice and give them information and easily do it. A lot of times I used to miss out on patients. I used to go to NICU. They were saying that there are 4 patients and I saw 3 patients. I came back, I have to again rush. So this will make life simple for me. For neonatologists, it will make it more transparent. At the fingertip, I have all the records of the patients. So that's all from my side. Thank you. Yes.
It's a very interactive type of app we have developed. How do you filter the information, because this information, if it is available to a person who doesn't understand the disease, would have a lot of issues in this.
No. So there are different, so once you go inside the app, there are 3 different, what we have done is there are 3 separations. One is the ROP specialist. So that is me or you, and you will click on it, you will have a separate page, and then you will be linked with all the neonatologists. that you can find out.
So
like
there is a firewall between these.
yes, yes, of course.
Very important, because
Very,
that's,
very
if
important.
it is there is mixing,
Data is,
it will create a lot of confusion in
it
the
will
minds
create
of.
a havoc, because intermingling
if
of
you-
data will create total, it will become even more worse than what we are currently in.
Any other questions if you have?
Yes, ma'am.
I have one question.
Morning.
This app which is there for the neonatologist, will it tell them which baby to send for screening, or how
No, no,
will
no,
that
no, no.
help him?
So there will be guideline. So on their screen there are guidelines. We have put up ICROP 3 classification, but it is variable. So whoever downloads, as a ROP specialist, you have access to their screen. You can put up data, new articles, whether like propranolol can be used for plus disease. You can put up new data for them. You can put up new information. But in no way we tell them which babies to. There are obviously guidelines are available, but they have to put up, or their staff has to put up the patient and patient's profile, patient's data and everything. Once they finalize that baby, only then it will reflect in your screen that this is a new patient.
Jitendra, great job.
Thank you, sir.
Can
Thank
you come
you.
and collect your certificate?
Yes, sir.